So my name is Bettger. I'm a health services researcher, and so what I do is I study systems. I look to build linkages. I try to help build stronger partnerships. And I started in research in high school because as a 15-year-old, I couldn't understand why we weren't bringing research from other disciplines to improve healthcare. It was as simple as, for me at the time, learning that we could use a readability index score to address the literacy levels in consent forms so people could understand what they were agreeing to. 10 years later, I cemented my commitment to promoting evidence-based practice when my father was diagnosed and treated for a heart condition that he didn't have. We lost him that year. And what was so opportunistic at the time was there was a position opening with the American Heart Association, and I was thrilled to join the team to begin to build stronger, evidence-based systems of care. So when I was asked to talk with you about AHA Inside, I thought this was a great opportunity to help particularly those of you who are not healthcare professionals understand the breadth that you just heard about in 30 minutes. Who in this room is not directly seeing patients as a physician, nurse, otherwise? It is so great to have you here. I want to help you make that connection to this organization as I did. Nancy and Eric have done an excellent job talking about really just how broad and how inviting this organization is. What I want to talk with you now, though, is this opportunity to partner with us. I think it's great that Eric can put himself out there and describe his role and his relationship with mHealth and how that describes and positions him as part of the problem. But together we can be part of the solution. Yesterday on my way here, I got lunch before I boarded the plane. Long flight to San Francisco from the East Coast. And I got a fortune cookie, and in my fortune, it read, "Great minds must be ready not only to take opportunities, but to make them." This is a room full of people with great minds. Innovators, scientists, experts, C-suite execs, staff committed to a mission or an idea. But how together can we make opportunities? And I want you to think about where that opportunity is for us today. So as a group of great minds, that's part of your challenge. Nancy had some very specific calls to action, but I want you to be able to leave today, as many of you have already experienced, the question I've asked when I've met you has been, what can your connection be to the American Heart Association? She also mentioned that we have 92 years of science. 92 years. I love these two pictures because this is in the 1940s when the American Heart Association transitioned from a scientific society to a voluntary health organization. Beside it, also in the 1940s, you see a picture of the first computer. The science has evolved over the last several decades, hasn't it, in both of these fields? And so think about where we're going to draw that intersection, and how does that relate to the work that you do? In trying to package 92 years of science and decades of mobilizing communities and volunteers in the fight against heart disease and stroke, this is the way I'm going to simplify AHA Inside for you today. And I'm hoping that you can identify and find one of these opportunities for how we can work together moving forward. We're going to talk about accessing our branded tools and programs, care plans, the digital content, and science. Nancy has talked with you about the science, the breadth, and really the opportunity here, working from whether you're interested in improving prenatal care to working with infants, children, families, aging adults, older adults, the oldest of the old. The science base for the Heart Association crosses the lifespan, and we can connect with each and every one of you in any of those, with any of those target populations. She also had a great slide, which I'd like to get a copy of, with the expanded areas that we cover. Because truly, we're addressing healthy living, healthy lifestyles, the prevention of disease. Whether you're interested in acute events, cardiac arrest, heart attack, stroke, whether your focus is on diagnostics, procedures, or supporting people living with chronic disease. Our science expands all of those areas across the lifespan and across the continuum of science, from basic science to translational research, clinical research, and in the communities. I want to give a very specific example of how we're also working across the continuum of healthcare. Each of these programs is built on a foundation of science that then is evaluated with evidence-based performance measures, generating data that we use for data-driven improvements in healthcare. Mission Lifeline is an example of how we work with emergency medical professionals. Get With the Guidelines, our programs focusing on improving acute hospital care, Guideline Advantage in ambulatory care, and Connected Heart Health, which you'll hear a lot more about, working to support people in their homes. Just one example of how we're also working across the continuum of healthcare, and you're going to hear these examples in some of the presentations later. Moving to digital content, we have so much of our information available and needing to be even more accessible to more people. So it's not just reaching healthcare professionals, but how do we reach children, families, work sites, schools? Some of this already through instructional videos, informational videos, magazines, cookbooks, quizzes, just all sorts. And we have so much more that we can do and innovate in this area with you, whether it's leveraging our content or partnering with you on how to create it to be even more accessible to more people. I'm especially excited about this area of care plans. Now, the idea of care plans are not new. They're not. We've been talking about these for decades. But what is new is the opportunity to use technology to build partnerships between healthcare providers and patients, and then be able to open up the world of our patients to information and resources that they wouldn't have access to beyond the 10 minutes in a clinic visit or that day right before they leave the hospital. There is so much more we can do in partnering with our patients and their families to support better care, and that's the opportunity with these care plans. And I'm really excited to hear some of the examples of these partnerships that have already started around care plans with the American Heart Association. Many branded tools and programs. Nancy covered many of these, and I highlighted three in particular. The Stroke Support Group is the Stroke Support Networks, rather, is such an amazing opportunity that we have just seen grow, and how we're connecting people with heart disease, stroke, caregivers, pediatric stroke, congenital heart disease, chronic heart conditions, families, people experiencing rehab and recovery. Have you thought about the value of support, the value of connecting? We're connecting today. How can we better connect people to each other? We also have another great example of now reaching a targeted problem rather than a targeted population. Eric had already described check, change, control and the history there. And I'm just thrilled with how this has taken off, especially with Tupelo Life. I was commenting last night, I still remember in December 2014 when I met Melvin for Tupelo Life, we were sitting together at a National Institute of Health meeting at a table, and I turned to him as an academic and I said, "What are you doing here?" It was a National Institute of Health meeting to learn how to write grants, mHealth grants. And he goes, "We need to study this. I know this can work." His passion was so infectious. I was just thrilled to think about the opportunity of where that work could go. And I'm just so excited that they're going to be here with you today to share how that has developed further and how their partnership has grown so much with the American Heart Association. So all of this accessible to you, and we're going to have several partners already talk about how they're working with us, not only through the Care Engine, but also through third-party systems and APIs. And really, I really invite you to ask these questions of how you can partner with us, how others have done it, where's the opportunity, and how could we move forward? Because really, where we are right now, and some of you saw, I tweeted last night, Jared Jocelyn's comment about digital health partnerships are really about vision and fit. And so where is that fit going to be for you? I think at this time where we think 92 years of science and decades now this is science for all of us in our own respective areas, and how we bring that together to move the field forward. I read, ideas are the currency of the 21st century. But really, those ideas need to be effectively packaged and delivered. And with that, we can change the world. Those ideas are only ideas. And what we're hoping today is to find out how that we can partner with you through some of this work to really improve population health. And we invite you to ask questions and talk with us today and move this field forward. Thank you.